Good evening, all. We, on behalf of the SREC Alumni Association and the Department of Biomedical Engineering, welcome you for the 61st webinar talk, Diverse Opportunities for Biomedical Engineers and How to Prepare for it. We welcome our Principal Ma'am of the day, Mr. Karthik Raj Konnaiyan, faculty members, current students, and all alumni friends. Mr. Karthik, after his engineering, did his master's in biomedical engineering at the University of South Florida. He was also a graduate research assistant at his university. After his graduation, he was joined as a biosensor development engineer, next as a lead process development engineer at Collegia Biosciences, later as operational research analyst at Bristol Myers Squibb. Currently, he works as laboratory automation engineer at Tolmar since Jan 2020. He has made few publications and filed few patents in his field of work. Over to Karthik.
Yeah, thanks, Vasanth. Yeah, when I initially got this invite, right, from Professor Sri Vidya Shakti, I just tailored this presentation to be more biomedical engineering focused. But after getting to know there will be participants from other fields and even the alumni, so I thought okay, just make it more a little bit generic so that at least other department people can correlate to their domain and what I'm talking about. So here, I mean, let's start with the question, right? What is the most complex system in the world? I mean, everyone can say it can be the International Space Station or the satellites or maybe computer or supercomputers. But technically, it is the human body, right? Where we have 38 trillion cells, and then billions of neural connections, and then synapses every second happening in a trillions per second rate. So to understand this, there are many fields we have, especially more focused on the medical, which is the surgeons and physicians or the doctors. But what does the role of biomedical engineer do in this vast field, right? So if you talk about that, it is kind of a mixture, applying both the engineering concept as well as understanding the basic science of the human body. It is kind of a diverse and it's a vast field to cover within few coursework. And yeah, and it has plenty of opportunities also because as we know, there are multiple things happening around the year, especially with the COVID, you know, there are a lot of potential opportunities, and also there are a lot of potential problems to be solved. And biomedical engineers come handy to that. It's kind of they already have a base science about what things are, etc., and they have the concepts of engineering where they can at least make a suggestion or make an improvement in the life of human, especially by making it can be making a prosthetics to making a study on a particular drug, or can be something like technologies like CRISPR, right, where you can modify the gene to have resistance to particular kind of things, like for example COVID. So it is kind of there is no horizon to think about what are the opportunities we have with this field. But for the scope of this meeting, right, I tried to divide this into 4 categories. Again, this is kind of based on the role. It's not all based on the industry. After doing biomedical engineering or after doing a course of bachelor's or master's, what are the opportunities they have in the industry or in this world, right? So it can be divided into 4, as you can see here, starting with research, manufacturing, and then solution provider, I would say, and entrepreneur. So let's start with the research. Yeah, I just want to give some intro. So I can speak for these 3 fields because I basically worked in a research and also as a solution provider, and also currently I'm working in the manufacturing unit. I don't have like a entrepreneurship chance, but again, I have put together based on my friends' experience and some of the seniors that I had who did this and who are still doing it. So, and then like after going into the each role, let's just have like a break, and so you can ask questions on like whether you have any questions on that or not. So let's start with the research, right? Like what like research is kind of like a broad term. I'm trying to like put together like a small slide where we can show like, okay, what or how to pursue this, especially like coming out of university. It can be any role. It can be like doing a PhD and a postdoc and then going into the academia, which is mostly followed here, at least like in United States. And then some people like try to tend to go into the research units of larger corporations, like for example, Apple as an R&D scientist or engineer, especially with the bio wearable units. As you know, like they have like Apple watches and everything that's coming up, and they are trying to incorporate a lot of things in the down the road. So that might be one of the role, like going to the research field. So when you talk about research, right? Like I mean, let's start with what the individual should start with. So if you're in like a bachelor's, second year, third year, or fourth year, the perfect thing to do is like start reading research articles. There are like plenty of sources, and you have like very good professors who can guide you to find these sources. But for me, like there are few like specific sources like Science Daily, which I was reading, and currently I'm not up to the speed, but yeah, they have like a very good coverage on what are the recent topics in the field. Not only with the science, like biomedical, it has like science and then physics, astrophysics, etc. And then there is also a new site called New Scientist. I think they have like yeah, plenty of information as well. So once you go through those articles, you will have like a hunch, right? Like that you want to pursue this particular field or this particular uh, topic. So, and then you can just like have a list of things that you can narrow down. It can be based on a lot of things. Like for example, like if you're in SREC, there are like particular things that we have, the resources that are available for us to use. Like for example, the nanotechnology laboratory, right? Where you can make like um, nano devices to capture or to code a particular antibody, and then you can take it like capture the particular antigen to make a diagnosis. So these are like some things like that you need to think about, like okay, what I can achieve within like scope of 3 years or 2 years, and then what I want to pursue in the future as well, so that you can start something simple at this stage by narrowing down your topic of interest. And then once you do that, right, you at this time, you know, like what the previous researchers have done in this particular field. So you can take those things and just make a few modifications. You don't want to like be, I mean, you can be an inventor at that point as well, but because of the time limitation, right? Like you can just make a like minor change to that research, and then like start making a questions like what you're going to measure and what data you're going to collect and how you're going to collect. So basically, this is like a mantra, I would say, for all the research. So once you have the topic of interest, you start collecting the data, and then you want to process and analyze the data. So processing, I know like there are plenty of methods to do that, and it's good that like at this stage you will know some like method that's widely used in the area of research. Like for example, if you want to like do a convolution, on the signal that you're going to collect, and how you're going to apply, right? So that itself is like a valid skill that you're going to acquire during this process. Um, so that's the one advantage. And also like once you have these skills, then you can apply for your future research. That will be like it will be so handy. It'll take some time at the first, but it's going to like be a lot more easier down the road. And once you do this processing, then you can find the trend that what you're trying to measure. So if you do that, if you can find the trend, or if you can discover the pattern, right, then you can like start putting together a research publication. And then like there are plenty of journals, but at this stage, like based on like your research field and also your scope of the research, you can publish it into different types of journals, but make sure it's a legit journal, because there are plenty of bogus journals. Like they say like they have impact factor of something, but they might not, and it might not be well recognized in the field of research. So make sure you have that legitimate publication. I think like we have like good professors, like they can guide you on like what publication can be like perfect for your particular research. And yeah, and other thing is like one day it's not only research, like right, you can go into the conferences. I think you guys are already doing that, but that's like a very good place to network, especially if you are trying to find a position like a PhD or postdoc in under a reputed researcher. So this can be a good opportunity. And try to like don't limit your scope only within the country. Try to like apply for other conferences. Like they, for example, um, like try to create a society for like when I say society, it's like a student society for a reputed group. Like for example, Ocean Optics, or what is it called, like a SPIE. So these are all like the organizations, like they have like a well-maintained funding. They can sponsor you for the travel and other expenditures if your publication gets selected for that conference proceedings. So yeah, I can also guide you on that if anyone needs some help. But there are like, yeah, plenty of opportunities to get that funding and like, yeah, do an international conference proceedings. And after that, like, like if you are already like chosen a good field that you are going to pursue on it, then you can like use that same data, and then again like make like some modification to that research that you have, and then take it to the next level, build a prototype out of it, etc. So for me, while I was doing my graduate studies, the same way, I was just reading some articles in Science Daily, especially at the time in 2013, there were like mobile phones were catching up with the technology, right? Like, I mean, um, they have like good camera and they have like a good processing power. There was a professor, Dr. Oskan from University of Los Angeles, University of California, Los Angeles. So he was doing some research on that. So I thought like, okay, why we can't use that? Because at my laboratory, there it's mostly like photonics and like they have a little bit of image processing and then like what is it, like programming expertise. But good, like as a biomedical engineer, we have like at least a basic level of programming. We are not um, like a coder, but at least we can, yeah, get things done. And like there are plenty of resources in internet today that you can just like use, and then like there is already like enough modules that you can use. So I try to use those things and then put together like a small app, a mobile app. Um, and then I try to like, okay, now I have like a technology. Now what I should do? Like I thought like, okay, what is the most complicated things that's happening in the hospital? So one of the thing is like the point of care. I know like there are plenty of blood results um, that needs to be available at the time of capturing. or like taking the sample, but it's not available. It's not happening like that. Like they try to sample the patient, and then they send the sample to the laboratory, and it takes like at least few hours to get back to the result. And then like after that, the physician need to see that to make a finding what is happening to the body or the patient. So at this point, I thought like, okay, what if there is a small device near to the patient that they can use to measure some like an analyte that can give some decision based on like some other additional data like blood pressure and etc. So I got some guidance from my professor, especially with the field of pregnancy. So there is like a complication, like it's called preeclampsia. I don't want to go in detail, but it's like a deadly complication. It can happen at the time of birth, childbirth. So it should be analyzed immediately or before that, so that they can save the lives of both child and the mom. So for that, like especially like in the developing countries, it might be useful to have like a mobile phone and additional device or something like something simple to capture whatever it is, and then measure something and then give some decision to the doctors at the time of sampling. So this was like a simple um, thought process that I took after reading some articles, and then like that happened to be a well recognized thing. Like I got this paper got some awards from IEEE, and also it went to the Nokia X Challenge. At the time, it was they were holding like a mobile based point of care devices contest. So so yeah, so I didn't like took like more complicated things. It was just simple, like just to use the existing things around me to put together a small research thing. And then like that got published, and also that was well recognized. And now still they're carrying out different things out of it. And like portable mobile based ELISA measuring system. So and I'm just sharing this example just so that you know, like, okay, it's not that complicated to follow the steps to be successful in the area of research. Any questions before moving to the next one, next silo? And if I'm getting more technical, yeah, please stop me. I try to go into technical easily. Okay, so let's just jump into the next one, next silo, right? Moving into the manufacturing. When I say manufacturing, it is like it can be anything from like a CT scan instruments to a pharma industry where they make generic or like a proprietary drug for underlying conditions. So where do biomedical engineer or biomedical engineers fit in this particular industry, right? It can be, I mean, there can be some roles like biomedical engineer 1, 2, 3 kind of thing, like based on the levels. But mostly, as we have the diverse background, right? Once we have like a necessary skill, we can go into most of the roles there, especially in the process development and also like a new product development or like a designing, and also even like automating few things in the industry itself. So, so we have the basic science, and we just need to get some technical expertise to achieve that. So let's just walk through like what are the processes that's being involved in this particular silo. So first, at the beginning, right? Like you want to choose because you are going to work in this industry, and you want to be passionate about like how you see yourself in this industry. So for that, you need to like choose like what product that interests you. Like it can be like, as I mentioned, it can be anything from lab on chip to robotic assisted surgical system like Da Vinci, right? Um, so you want to choose something like that, and then see um, understand what is the high level process that's being followed. Like most of the industry, they have like starting with a product development or a new product development, and then they file the patent, and then they have like a prototype developed, and then they need to be verified, like quality check, and then there are like intermediate steps, but and then like finally like shipping, sales, etc., etc. But you just need to know the high level process so that you can see what role that you will be interested in. So this is like important too, right? Like for example, if you have like a good vision about like how the product should be, or if you like designing something, you can start with okay, choosing that particular role, and then see what are the things that you need for that particular role. What are the skill set you need? Um, so in the free time, right? Like you can just go into the job ads for that particular role, and don't limit yourself to what is that, like a one area. Area means like a particular location, because like the role or the requirement can vary from country to country, or like even the location within a country. So just like search for like all the international postings as well, and then see what is the common skill that's being called out in the job ads for that particular role. So this will be like very helpful so that you can just like take those skills and then shortlist them, and then see how you can develop them. For example, like lab on chip, etc. Right? So these kind of products that require some, if you want to design something, there are some like CAD tools that's available even for students. Um, so you can take advantage of them. At least use the trial version if you just want to know like how things are and how it looks like. And also you can just email them to see like if they can like offer a student license. Most companies will offer a student license if you're requesting through an email, so that you can just at least know how to use that, and how to make like a device out of it, right? A prototype. So this is like just uh, like a play, right? You just need to like know what things you require to start that particular role. So just be consistent and on, and always be looking for advances in that particular technology, or in that particular the skill set in the market. And then once you have that, like yeah, as I was saying, like design something, or if you have like some 3D prototype, 3D print, yeah, you can 3D print or something like that, and take a picture or make a video out of it. Now I think we know, like we have like a plenty of platform that you can use. So you can maybe create a blog, and then put all together in that blog, so that you can, while going for an interview or while applying for some other opportunities, right, you can just showcase what you have done um, for that particular role, how you are prepared for that. So this will give all the recruiters a good a sense of feel that you are already taken a good um, a groundwork that you have done on this particular topic. And I'm just putting myself here, right? Like for me, I was going into the pharmacology, especially the development of like a generic drug, and some they have like proprietary drug as well. So here I thought like, okay, how I can automate things. So for me, automation sounds like something interesting for me. So I chose that role, and I saw like, okay, what are the requirements they have? And then I can see like, okay, in the pharma industry, there are few tools that they usually repeatedly use. So I just learned that, and then like I put together like a small presentation, like, okay, this is what I have achieved in my past, and then that landed me a job like very easily without any further interviews. So any questions on this one before moving to the next silo? Okay, just move to the next one. Here I mention as consultancy is because like there are a specific industry we have that is mainly focused on helping other like manufacturing units. They don't have, I mean, they might have their own product, but it's mostly they are like being a support for the other industries by providing some manpower as well as from technical expertise what they have from their group of people. Here, what I'm seeing is like in the industries like medical device manufacturing as well as the pharma industry, right? Mostly now they have a lot of paperwork. Like it's medical devices and pharma, which is like a very regulated industry. So they need to have like all the things to be documented very well and also stored properly, etc., etc. For that, like most of the companies, they were like usually like like in the past years, they were using still papers to measure something and then say like, okay, this is like a quality control verified, something like that, and then they document all those like papers in the binder and then they store it in a shelf. But nowadays it's been changing, and still like when we talk about like digital and digitalization, right? Like going why we can't use electronic format, etc. And it's possible, but still many industries still lagging on this particular process, and there are plenty of opportunities like in states itself, in United States itself, to convert everything into the digital formats. And yeah, they have like plenty of roles that's being like posted every day. And most of the companies, they already know the path, but they don't have like an expertise to do that. So this is where the consultancy company comes in. They say like they have the good what is that, like a strength in doing these things by repeatedly um, like applying this thing to different companies, and they have expertise on this. So let's talk with the digitization and digitalization, right? What is the difference? Digitization is something like, for example, taking um, a cassette, right, with the music cassette that we had, and converting that into a DVD format. That itself is like a digitization. Um, so, and here in pharma industries and other industries, like we are converting the paper-based information into a digital format. It can be anywhere from lab notebook um, to validated documents. Um, and digitalization is something like to apply the, the latest technology to get like an insight of how the company is doing and what can be improved to make the goal met. So for that, like they follow like different things, but you can just like go into the internet and see like what are the digitization and digitalization trend in recent years, and then from there you can narrow down the scope. Like, okay, what kind of information you like to play with. It can be anything from patient data to like um, uh, what is that, like analytical device data. Um, so and so at this point you can narrow down the scope. Like, okay, what kind of, again, the same with manufacturing, what kind of role or what kind of domain you want to work with, and then from there you can see like, okay, for that again, as I said, like you need to try it out before getting that the finalization of what you want to like do after graduating. So for that, you can use some open data repository that's available free in the internet. Again, like this can be applied not only for this particular role, for the research as well. You can take these kind of like a open repository and then play around like with those data, because sometimes you don't have resource availability to capture the data from by yourself wherever you are. So at that time, this will be like very handy. You can use that the repository to gather the data, download the data. Like I have given like some of the example, right? Like Open Science Framework and Science Data Bank. they have like a good amount of information in it, including publications, preprints, etc. That can be like very helpful, especially while doing some data analysis. Um, after doing the after getting the data, right? Like you want to do some analysis and then put together an intuitive report, because while like all this consultancy, the main thing is like how you are presenting the information to the management or to the companies, so that they can take that information and change the process. For example, in like the currently I'm working in like helping the quality control lab. So they have like a different process, and then they want to test the product that's coming in the conveyor belt, to see like whether they meet that specification for a particular country. So it can be, for example, some percentage, right? It can vary from 98 to 102. So the mean should be always 100. So you can just like pull the historical data, and then you can just show like, okay, the process is being followed. There are like one standard deviation that's always happening. To reduce that, you can change one process in the manufacturing, so that we can again see the results, and then that can show like, okay, it improved the outcome drastically, something like that. So like putting together an intuitive report is kind of like a good skill, like how to simplify the information, the complicated information you have, to make a business decision out of it. So there are plenty of tools, but again, like at this point, you can research what is being commonly used in your particular field that you have chosen here, and then say like, okay, like for example, there are like a Spotfire, which is a reporting tool, or a Crystal Report, or a very basic thing can be like a Microsoft Power BI. That's like a free tool that you can use that can provide a lot of insight, and that's being like widely used in the industries. And yeah, having that skill set in your resume, definitely it will be helpful for landing in a job in these kind of companies. And then once you have that, again, as I was showing in the other slide, right? You need to publish and share that information. Maybe you can, while you are doing your undergrad, you can just like make a paper out of it and then publish it to the journals, or you can just like make a paper and post it in a scientific community to get their comments. So this way you are collaborating with the other people, and also you are showcasing your skills that you have acquired during the past few years using this approach. And then again, like once you have that, again, you can reuse the data, and also like you can integrate new things to that, especially like a little bit of um, like exporting, right, or sharing that information. Like instead of reporting, you can just like make it as an email notification whenever there is a result that is lower than your specification or something like that. So that can be like additional functionality that you can play around. So when the recruiters see this kind of skills you have, and they can closely match you with whatever the company is doing, and then they can say like, okay, you can be a best fit for this role. So this can be like very handy doing taking this approach. And this I was in this role in Bristol Myers Squibb. It's a pharma company again. So I was helping with the electronic lab notebook. Again, like they have like all paper-based notebook, especially in the research, but it's hard to manage the data when it's paper-based, and you want to transcribe all the data again with the manual process of looking into the papers and then entering into the sheets, like Excel or something like that, to put an insight of what you are doing or what the lab is doing. So for that, like I helped using a electronic lab notebook to make a template out of it, and then like so that the users they can enter the results directly, or they can connect their instruments to that particular software, so that information can be pulled directly into that lab notebook, and it can give a nice pictorial graph showing like, okay, how, for example, an assay, right? What is the measurement that you can take, and whether it is within your limit, or whether how it can improve that particular like drug or something like that. So I was helping on that particular part, and that was really helpful for my other jobs as well. Any questions before moving into the next one? I think, yeah, we have a few more minutes. Let me just go through that other thing quickly. So if you don't have any questions, let's move on to the entrepreneurship, right? Um, Again, as I was saying, like I don't have like a direct expertise on this one, but at least from my friends and other people, I have learned few things, like how to like if you're starting a business, how to do that. So everything everything what I am discussing is all about problem solving. It's not only with a particular department or particular field of study that you're doing. It's about like wherever you are, like what is the problem that you have in your hand that you're going to solve, that will give the world a better outcome. So for that, like you just like in the business, in every business, right, you want to identify a pain point um, that you want to see. Like it can be like anything from like very simple thing like handheld devices, point of care devices, like whatever I said, to something complicated, right? What's the global problem that we have, like plastics, like how to degrade them? It's so hard. So to do that, like some of the research scientists, right, they have came up with a plan just to see like they took like a bacteria sample from a garbage where they saw like one particular variant of the strain had a potential of converting the plastic into something like carbon dioxide and also like some other byproducts, but it can degrade the plastic very quickly. So they took that and they are studying to make it as a viable product for the problem that we have in the hand, right? To how to decompose the plastics quickly. So this can be like a potential idea or that they can take and then market it, and they can get enough funding to make or build a company out of it, and then like solve that global problem. So it can be either from a simple concept or a complicated concept like this. So anywhere like the thing is that you want to identify the pain point, what you are going to solve. And once you have that pain point, you can have like a multiple ways to accomplish this. So that is where you need to like brainstorm the ideas with your colleagues or with the people at the area of expertise. And and at this point, you don't want to limit yourself. You can just put together all the ideas that you have, and then you can narrow down the ideas using the financial or time constraints, whatever you have, like the things that that is going to like pull you down. So based on that, you are going to like narrow down what is the feasible or viable idea, and then you can build a prototype out of it. You can create a video or drawing or a model or whatever it is, or a 3D print, and then you can use that for your pitching of your idea in the before the venture capitalist. And once you do that, you can test the prototype, and then like see what are things you can improve to whatever the project you're doing or whatever the question that you're going to solve. um, so here there are some things that will be helpful, like this is also helpful even for your if you're going into the industry. um, there are like kind of different methodologies that the companies can follow. One is like make a like a SWOT analysis. So usually, like whenever like some companies need to take a decision, they can use the SWOT analysis. You can just Google that to get more information. But and there are like SMART goals. So this is followed in the most of the companies, especially GE. They follow this goal and also along with the stretch goal. So that gives like a good combination of what can be achievable, and it can drive you to your goal within a certain time. So everything is like writing it down and planning it carefully. This will be very helpful, it will be very helpful and handy if you are pursuing this particular domain. And then, yeah, once you have the prototype, you can just launch the business. And then again, you can get enough funding, and also like you can apply for the government subsidies and etc. To build, yeah, constantly building something onto your company. So this is one of the thing. And if for all these things, right, like the main question will be like, okay, I don't have time at all. Like, okay, how am I going to do these things? It's more like time consuming. While I'm doing a bachelor's, I have like already enough coursework I need to do, like handle, and how to find time to do these kind of things. So the one thing will be, nowadays we are constantly being hit by a lot of information. Like I would say, like the information overload, right? Every day you are getting the information from all around you, so you don't know how to focus and where to focus. And this is like a very important thing in recent days, especially when you have the powerful tool in your hand, the mobile phones, right, the smartphones. The this is a common thing. Like I think it's being like a major topic of discussion nowadays. What is the addiction that we have in 21st century, right? It's all the dopamine hit from the information, that bing that sounds, right, like that you get in the mobile phones, that constantly give you the dopamine hit. You want to check that what is it, and etc., and that will like pull you into the rabbit hole. So you should be very careful in you can choose what information you want. And especially it's so hard with this digital era, so you want to be more careful. And if you say like I don't have time, you can find like, oh, okay, what time you are spending on your devices on. These are like some few tools that will be helpful to do that, like Facebook or YouTube, right, like your or Netflix. If you're spending a lot of time, you can just limit that, and you can spend time on other things. Because for all these opportunities, you want to be more persistent on whatever you are targeting for. So for that, you want to be more focused. And I know it's so hard, while especially being in a undergrad, and especially like knowing a lot of things. So yeah, just and that's one last information I need to share. Just you want to be carefully pick the information that you have around you, so that you don't like dive into the rabbit hole and then you get lost with the time. I think that's all I have. Any questions or any comments that you guys have? Hey, Vasant.
Yeah, Karthik, yeah, that was a good presentation.
Yep.
But
Thanks.
yeah, on a personal note, I want to understand, like, you have been into research, now into manufacturing and all those things. So
Yep.
how about your entrepreneur journey?
It's going to happen soon. I'm just waiting for a few things to settle, so that I can pursue that. But it's still in my list,
Yeah,
for
it's
sure.
it's on the list. It's on the list. All the best.
Right, thanks, Vasant. And yeah, one more note: if you guys have any questions or any suggestions, or like I mean, not suggestions, any comments that you want to clear your mind of, you can just like send a message or email through LinkedIn. And I think Professor Sri Vidya Shakti has my personal email as well. So if you want to like get into the research or something like that, and especially in United States, yeah, I can help you guys with whatever I can.
Karthik, I have one more thing.
Yeah,
Like
sure.
means I mean, see, I'm not into this field. I'm totally out of it. I'm into electrical. Like for my general understanding and for the students here, I want to understand about how about the scope for a biomedical engineer in India and US, or probably the rest of the world.
Yeah. In India at the time, like while I graduated, there were like few manufacturing companies, but most of the medical devices, they try to manufacture things like in Germany or China, but most of the like the programming, or like the user interface development, everything that was happening in India at the time. While like there were no consulting companies, and now I can see a lot of consulting companies, including like few that you can find in my LinkedIn, right? So they are helping with a lot of pharma companies being in Chennai and Bangalore. They have like good like branches, and then they have like a good positions, like especially dealing with the data and also the research analyst role, right? Um, so and now I can see like there are few companies also being like um, developed in India itself to do the medical devices. I know a few contacts in Medtronics. I can see like they are more into like even like, as you know, like there are like the conflicts between US and China, right? So they're trying to bring the manufacturing into India as well. And so I think at this point, like there will be, I can see like there will be more opportunities into the manufacturing as well. And also like obviously the research, we have like a good amount of positions, especially in the pharma. And I think there will be like more upcoming into the I mean, it'll be like opening in upcoming days. In US, I would say like they have they have options for all these three, all the four. It's equal. And the one thing with research is like mostly people end up in academia, especially being a professor or like starting a lab and a startup company together. So usually most of the professors I know, right, they have a startup company as well as they do research in the university.
Yeah,
So
Karthik.
they would, yeah. Hello, Thomas.
Yeah, I have one question.
Yep.
When can we say biomedical engineering is booming? For example, we have a COVID pandemic now,
Right.
and I'm able to see a number of medical equipments coming into play, like pulse oximeter. Earlier, though we have heard we are not using it, but nowadays we are using it, and similarly, oxygen generators and stuffs like that. So, is this time perfect for biomedical engineering?
I would say because the one thing that we are trying to unveil is the data, right? The data is driving everything like nowadays. It's not like a decision based. It's all like data based decisions that the management is taking. So why I'm saying the data is like the human body produces enormous of data. Like to understand that, right? Initially, when they found the ECG signal, right, they don't know like, okay, what does the bad ECG signal means, or what is the particular signal means to our body. But I think now they are kind of like unveiling a lot of things. Like not only ECG, we already have it, right, with a lot of research that have done in the past years. But nowadays it's being like more into the neural, especially the neural signals. As you know, like Elon Musk's startup, like they are trying to like understand the wiring of the brain, which is a complicated thing. And I think like we are already in the beginning stage of this era where the data is going to drive a lot of businesses, and especially it's also important in the biomedical engineering field. It's not only manufacturing a device, right? You need to understand what the device can do, and they're trying to integrate a lot of things, especially with the robotic surgery and the telemetry, where you want to like make a surgery from here to a patient somewhere remotely sitting. Um, so I think it's going to boom in the upcoming days. But in India, I think at least there are like I can see the signs that's being like started, that okay, there is something happening in India, especially after the pandemic. But again, it needs some investment. I think the governments are working on that, especially as I was saying, the conflict between the China and US. They're trying to focus more into bringing resources or like putting together a unit in India, so that they don't want to rely on the countries that they don't want to.
Karthik, can you explain about the role of biomedical student in science, specifically genomic data science?
Yeah, and that field I'm not too into, but I can see like genomics. When you talk about genomics, right? Like I mean, as reading a lot of things, like there are a lot of technologies that's already available that we need to exploit. But the problem is that like there are like some ethical concerns that's happening. But I think at the lab level, there are a lot of researches happening, especially with CRISPR, and then other genome editing technologies, and especially like modifying the unwanted genes that's causing the trouble, right? With the cancer, it can be something from cancer or something that a virus can attack, right? Like the pandemic, like okay, the virus can attack a particular gene and then like make the changes out of it. So what if we can edit the gene and then make it more resistant to those kind of RNA that's coming into the body? So I think that research is already happening, but I think that's going to boom as well. The one thing that's holding behind all these uh, new technologies is the ethical concerns that they are having. I think you already heard about the CRISPR, how it's misused in China, right? So did I answer your question, Shakti, or were you?
Yes, thank you, Karthik.
Hi, Karthik. This is Lavanya from Biomedical.
Ma'am,
Hello, Karthik.
how are you?
I have one question. Can you
Sure.
tell me the opportunities and internship opportunities available for biomedical students?
Internship opportunities abroad or here?
Both.
Okay. I mean, yeah, here I see India. Okay, so in India, there are like opportunities now, especially with this consulting firms. So I have a few contacts as well. I think they are planning to like have like more interns as well in the upcoming days because the business is kind of booming. As I was saying, all the data are being digitized, and it's so hard to analyze those information to get an insight of what the data means and what it can provide for the business. So and as I was saying, like for our students, it's easier to have access to the computer than like some complicated instruments. So for that, I would say like if they can focus on that data role, there are plenty of opportunities for that. In United States, it's kind of it depends on the domain that you're focused on, right? Like there are still plenty of opportunities for biomedical interns, but the thing is that like here in States they don't. I mean, they consider biomedical engineering as a role, but it's more like a process development and like automation. Automation, if you think like they will start with like a mechanical engineer because they have already a good base out of it. Whereas for biomedical engineers, it is kind of something new. But if you have the skill set that I was showing in the other slides, right, then I think it will be easy to compete with the other departments to get the internship.
Thank you, Karthik.
Sure.
If I may add, my name is Naveen Krishnamurthy. I run a consulting company called Acode Idea in Coimbatore. We have one of the best teams when it comes to the QMS practices. So if people are really looking for any serious intent to hire opportunities, get back to me. I would be able to help you because we are also opening up our internship slots on the 15th of August, maybe on the Independence Day. And if you want to focus from the reverse engineering part, wherein, first get into the company and get to know more, I would really say like, you have to get into either research or consultancy. So, because manufacturing, what happens in India or the scene that is happening in India is, it is not matured enough for any new practices, but for research, IISc Bangalore is doing an awesome job, I would say. So if you have any particular research idea, they are very easily, or they have good contacts with BIRAC, and they could be the right people to take things forward. At the same time, like, for the consultancy, like one particular area that people can focus on, like apart from the data analytics part, is quality management systems, because QMS in any regulated industry, and number one regulated industry is aerospace, and number two is pharmaceuticals. So I'm talking based on the business volume that happened in the last 5-6 years. But if you actually take on the impact side, number one would be pharmaceuticals and number two would be aerospace. So QMS, that is the quality management systems. If you are really interested into this role of the business analyst or validation engineer, where you will be having QMS as a paper. I don't know about the electives now, but usually QMS as a paper. This is the area for you to focus on. So there are specific softwares like VivaVolt or TrackWise, which are niche in this area. So focus on this niche area, get these niche skills updated, and as a result, you'll land up in a very high-paying job. So these industry openings usually open up anywhere between 3 lakh to 6 lakh per annum packages, where you'll be able to easily get this job. So second area that you can really focus on if you want to get into the consultancy area is the documentation part, or it's also called the technical writing. So if you feel like that this is in my forte, that region as well you could focus on. But the problem with technical writing is like you will be there as a technical writer, and you will have to be there as a technical writer for at least a decade before you see the next level of growth. So these are the two areas which I am seeing which would boom. I have also put out a link of the McKinsey survey that was taken in 2020, where they would talk in detail about what are the challenges, problems, and where the pharmaceutical sector is growing. I'm not talking about the manufacturing or the medical devices at all. But if the goal is going to be placement, or if the goal is going to be getting into internship where you want to really learn something very quickly and implement something very quickly in India, I would say focus either on the research area or on the consultancy area. Karthik, thank you for the insights. It was great actually, and sorry for barging.
Oh, no problem, Naveen. That's a good information to add. Yeah, I forgot about mentioning about the validation part. Yeah, as Naveen mentioned, that the quality management system is it's a booming field as well.
Good thing about the biopharma sector is it is highly regulated and it is highly defined. So the scope of rework or the scope of getting into deep research is very much structured. So you'll be able to see very consistent results. So if you want to really focus on that one area, like get into the biopharma sector, be it into any of these four verticals: research, manufacturing, consultancy, or entrepreneurship.
Audience, if you have any other questions, you can put up to Karthik.
But I can also share this slide to you, Vasanth, so that you can just put it wherever you're placing this video. All right. Thanks everyone for your time. And
Karthik and Vasanth, since there are no other questions, I think we can go for the closing remarks. Shall we proceed?
Yes, Thomas, sir.
Yes. So thank you, Karthik Raj Konnaiyan from the batch 2013 Biomedical Engineering. Thank you so much for being here for our webinar number 61. It was a very short notice what we gave through Sri Vidya Shakti, biomedical faculty, and all of the faculty members. Thank you, Biomedical Engineering, for roping in Karthik Raj Konnaiyan. It is an early morning for him, that was Sunday morning. Thank you, Konnaiyan, for the wonderful presentation, putting up together research, manufacturing, consultancy, and entrepreneur. Very beautifully put up. Thank you so much. Thank you, audience, for joining in and for making this evening memorable. Thank you, faculty members and alumni members from all over the globe attending this webinar number 61. Thank you so much. Thank you, one and all.
thanks everyone for providing the opportunity. Thanks. Bye. Take care.
Thank you. Thank you.
Thank you, Karthik.